Imagine a world where words are not just spoken, but also repeated over and over again. This peculiar language is known as echolalia. Although it may seem unusual to those unfamiliar with it, echolalia serves as a unique form of communication for individuals with certain developmental or neurological conditions. By exploring the origins and uses of echolalia, we can gain a deeper understanding of this secret language of repetition. Echolalia, at its core, is the repetition of words or phrases without necessarily grasping their meaning. It's like a musical echo, where the words are reverberated and echoed back, creating a pattern of repetition. While it is often associated with autism spectrum disorder, ASD, it can also be seen in other conditions such as developmental delays, language disorders, or brain injuries. The origins of echolalia can be traced back to early childhood development. Children naturally imitate the words and sounds they hear, using repetition as a way to learn and practice language. It acts as a stepping stone towards acquiring vocabulary and mastering pronunciation. In typical development, as children grow older and their language skills progress, echolalia fades away. However, for some individuals, the repetition persists into adulthood and takes on a different form. For those with autism spectrum disorder, echolalia can serve several important purposes. First and foremost, it serves as a means of communication. Many individuals with autism struggle with expressive language skills, making it difficult for them to express their thoughts and desires. Echolalia can act as a bridge, allowing them to communicate their needs and wants by repeating words or phrases they have heard before. It provides them with a tool for interaction, even if it may not always convey original thoughts. Furthermore, echolalia can act as a source of comfort and self-regulation. Many individuals with autism find repetition soothing and use it to calm themselves in moments of stress or anxiety. It acts as a familiar and predictable pattern that brings a sense of stability. This is sometimes referred to as stimming or self-stimulatory behavior. By echoing certain words or phrases, individuals with autism create a soothing rhythm that helps them manage their emotions and navigate the world around them. There are two distinct forms of echolalia: immediate echolalia and delayed echolalia. Immediate echolalia refers to the immediate repetition of what one has just heard. It can be likened to echoing a conversation in real time. For instance, if someone asks, "What's your name?" an individual with echolalia might respond by repeating, "What's your name?" instead of providing their own name. This form of echolalia is often seen in individuals with limited expressive language skills who rely on repetition to communicate. On the other hand, delayed echolalia involves the repetition of words or phrases heard in the past. It is often used by those with autism as a way to process and understand their environment. They may repeat lines from movies, songs, or previous conversations as a way to make sense of the world around them. In this sense, delayed echolalia acts as a form of self-expression and a way for individuals with autism to engage with their surroundings. While echolalia can be a valuable tool for individuals with autism, it is important to note that it does not replace functional language skills. Encouraging and supporting the development of expressive language is crucial to help individuals enhance their communication abilities. Speech therapy and other interventions can focus on promoting language acquisition while taking into account the individual's unique communication style, including the use of echolalia. In conclusion, echolalia is a secret language of repetition that holds immense value and meaning for those who use it as a means of communication and self-expression. It serves as a bridge between individuals with autism and the world around them, offering comfort, predictability, and a connection to others. By understanding and accepting echolalia, we can create a more inclusive and compassionate society that embraces the diversity of communication styles.